I'm Michelle Patterson-Kemp. I'm 43 years old and I have sickle cell anemia. I was diagnosed with sickle cell anemia when I was 2 years old. So when you have sickle cell, you get these painful crises that would happen just from a lack of certain areas of your body getting oxygen. Before, I was getting sick like maybe every 2 months or so. I would just wake up in pain, and it would usually happen in the middle of the night. But now I'm getting an apheresis treatment, which means I get about 8 units of blood every 2 months. This treatment has been life-changing for me. I don't have to go to the emergency. I don't have the painful crises episodes. It's just been miraculous. I have horrible veins. I've been needing to get IVs and blood tests all the time. So usually when you go to the hospital and draw blood, they would get it from this vein, the antecubital vein it's called. That one is totally scarred on both arms. And so trying to start an IV that's large enough for me to get my apheresis treatment is impossible. And so they decided that putting a temporary femoral line was the best course of action. So it's a central line and it's double lumens, so it can take care of taking blood out as well as getting blood in, so it's quite large. And what they do is under radiology, so it's guided, and they're able to accurately place the central line in my femoral vein. I know that when my mom got the diagnosis and was told that I had sickle cell, she was in tears and she just felt like it was the end of the world. But it really wasn't, and there's just so much that's happening right now, and there's so much that I've been able to witness. And one of the things that I take and I carry with me with having sickle cell disease is a sense of purpose. The population, because of immigration, there are a lot of different people that are coming from all over the world, and sickle cell is becoming a very common thing to see in Alberta and Edmonton now. So they do that through the radiology department. I get that inserted. And then from there, I go to the apheresis department, and that's where I actually get the treatment. So I get my 8 units of blood, and that takes about 2 hours. Before I get my treatment, they draw blood because there's pre-blood work that my doctor needs to monitor. So they want to check red blood cells, my ferritin levels, all those different levels that my hematologist wants to monitor. We have excellent hematologists here in Alberta, and we're very lucky that our healthcare system provides this for us. I get about 8 units of blood every 2 months, and sometimes they have to get that blood from Toronto and from other areas. We're already compromised with our being anemic. They want to make sure that the best blood is coming into our bodies to not compromise us even further. Before I was getting these treatments, I didn't even consider having kids because I just felt like I was too sick to take care of another little child, and I didn't want to put that stress on myself or my husband. But now this treatment has been so life-changing that I've been able to have a child. It was something that I would have never considered before. And there's so much hope with sickle cell right now. There's lots of doctors who are doing their darndest to try and find a viable cure. And if you can't do the cure, they're trying to make our quality of lives better by the treatments that they're able to provide for us. And then after the treatment, they take out more blood just to see how my body is reacting to the treatment itself. And then after that's done, they remove the line completely out, so it doesn't stay in there at all. And then they send me to the recovery, where I have to stay for about 2 hours just to make sure that nothing happens with the femoral line and that I don't start bleeding. Because it's like when they insert it, it's like they're stabbing me in the groin there, and that's such a large vessel. So they want to make sure that it is fully clotted and that it's not going to spring a leak. If you have a child that's been diagnosed with sickle cell, like, reach out to the Sickle Cell Foundation of Alberta, because we're here to help each other. I have sickle cell and I'm doing okay. Your son or daughter, they're going to be fine. You know, the main thing is to see your doctor, keep regular appointments, get connected with a hematologist, and trust your instincts, right? You can have sickle cell and live an awesome life. What you don't see a lot on the internet are stories like mine, where people are living with it, they're, you know, being compliant with their therapy, they're making their appointments, they're keeping their immunizations up to date, they're doing the things in order to keep their body as healthy as possible, so that when that cure comes along, my body is ready for it.